Hi, LaNette. This is in response to your discussion post on insufficient human resources. When considering the lack of human resources in low and middle income countries, one must also consider why there is a lack of human resources who are adequately trained in mental health care. If I could recall correctly, in chapter 10 of our textbook, Kakuma et al. Discusses such issues as stigma surrounding mental health that prevents professionals from pursuing a career or education in the field of mental health, as well as working conditions in low and middle income countries and inadequate pay. I noticed that it's difficult to find human resources here in the US to work in mental health, especially in my job where I work with offenders with mental illness, and it's been difficult to maintain staff due to stigma surrounding those who are considered criminally insane. I feel that because health authorities and policymakers in low and middle income countries don't feel that mental health is a priority, and they don't feel that mental health interventions are effective. Still the stigma surrounding those who do have mental illness, and policymakers and health authorities choose to allocate funding to other basic health priorities. And this might actually discourage mental health professionals from working in these countries. Aniva et al. Discusses how in Ghana, mental health professionals felt that there was no priority given to mental health, and this was reflected in the treatment facilities, which showed signs of neglect and a lack of support from other health disciplines. After considering why there are insufficient human resources, health authorities can work on developing methods to train and retain mental health professionals, as well as putting forth more effort into understanding the needs of mental health workers who are still currently helping in low and middle income countries. Many issues, such as working conditions, that's not really able to be solved, especially in a low income country where funds are already limited. But incentives can be offered to those who are willing to stay, such as helping them with continuing education credits or maybe helping them with student loan payments or loan forgiveness. While step one in developing a national mental health policy is important, I also feel that step two, gathering evidence for effective strategies, is also important in that it focuses on reviewing cost effective interventions for mental health, which can include task sharing, which can be cost effective in that they can pay non specialists a lower pay, which can leave funds available to employ those more specialized workers, such as nurses and psychiatrists. You discussed a bit about the World Health Organization mental health policy plans and programs resource guide and methods for resolving the issue of insufficient human resources that include allocating funds to properly train primary care teams. And in this article that I read for the Lancet, Kakuma et al. Did an article with them as well. And they stated that there are six components that are essential in developing human resources in their policy, health, workforce management, finance, education, partnerships, and leadership, in which the leadership in ministries of health can apply these components when trying to overcome the barrier of insufficient human resources.